All right, we're going to get started. So when we conceived of this session, we were really thinking about not just for folks that are going to Hill tomorrow, but especially for folks who may not be going to the Hill tomorrow, what is the most effective way for us to be communicating with policymakers, especially in this moment? And so really grateful today to be joined by Carianne Lee. She is the Director of Climate Policy and Appropriations for Pioneer Public Affairs, and they work with a lot of various clean energy groups to talk to members of Congress. So she brings a deep expertise there. Gary Ewart is a close friend of ours as well. He's the chief of American Thoracic Society's Advocacy and Government Relations. And we know Gary well from our work together and Healthy Air Partners. And so we've long admired all of the insightful things that Gary brings to this discussion as we're thinking about how health professionals can best leverage their voice on policy. And with that, I'll turn it over to Carianne. I think you're beginning with the PowerPoint.
Yeah. Hi, everyone. Thanks so much for having us here today. We're excited to talk about effective communication with policymakers. We can go to the next slide. So as Lisa said, I'm Carianne Lee. I'm the Director of Climate Policy and Appropriations at Pioneer Public Affairs. Pioneer, we're a clean energy, clean tech, climate solutions, government relations firm. You can go to the next slide. Here's a little snapshot of some of the clients that we have. We've got, your clean energy, clean tech companies working on really innovative technology. Got some investment firms, and then where I reside most heavily is with our nonprofit 501c3 and C4 clients. And so I focus a lot on helping them develop strategies and implement said strategies and engaging with the federal government. So we're going to talk a little bit about sort of Congressional Advocacy 101. You can do the next slide. But I'm going to talk specifically about sort of everything that goes into all that before you walk into that meeting. And I'll hand it over to Gary to talk about once you get into that door and what you want to talk about once you're there. So here's a real quick overview of what we're going to cover. Broke it down to the who, what, where, when, and why. Try to make this easy. And then because I live in the climate space, want to also chat a little bit about climate in this current Congress. So imagine you've decided that you want to have a Hill day, or you want to go meet people, or you've got something you want to talk about with your lawmakers. You've got a question of who you go and meet with. So here's a way that I like to break it down so that you can be strategic with the time that you have, assuming you don't have the ability to meet with all 435 members of Congress. Here's an easier way to break it down. The first is if you have a constituent in your group. Let's say you're bringing someone in, they've got an amazing story, and you want to convey their story to a member of Congress. Great way to start is who's their member, who is their representative, who's their senator. Easy to find this via congress.gov. You plug it in their zip code. So if you're taking me, I'm from Pittsburgh, Pennsylvania. You'd probably want to take me to Congressman Chris Luzio or Congressman Summer Lee of areas. That's an easy way to break that down. Second way that you can think about this, finding members that have a personal interest in whatever issue you're bringing to the table. So, for example, let's say you want to talk about extreme heat. You might want to go to someone like Senator Ruben Gallego. He used to represent Phoenix, Arizona, where they had 100+ days of 100-degree temperatures. And so he obviously has a very, very personal interest in this matter. So you may not be a constituent, but obviously he wants to talk about these things. Really great way to find someone who has a personal interest through and looking at their press releases and their legislation that they put out to identify that. You can also look at the caucuses that they sit on, and I've listed a couple up here, which are kind of like affinity groups when you're in college, and everyone has shared interests. So that's the Congressional Progressive Caucus, that's the New Democrat Coalition, that's the House Freedom Caucus. You can kind of find people within those groups. And then the third way that I like to identify who you want to meet with is if they sit in a position of relevance. So that could be if they're a leadership, that's your Senator John Thune, Senator Chuck Schumer, that's Speaker Mike Johnson, that's Minority Leader Hakeem Jeffries, as well as leadership within committees. But then that takes you to any committees of relevance to the work that you're doing. Within the health space, you'll frequently think of the Health Committee on the Senate side, maybe Energy and Commerce, and Health on the Senate, Energy and Commerce on the House. But start by identifying what are the issues that you have, who are the people who maybe want to play in this space. Ideally, you can hit all three in one go. But again, there's a lot of folks out there. It's sometimes hard to do that. But that's how you can start planning your Hill day or your meetings on the Hill. Next slide. So you've now figured out who you want to meet with, and you're trying to figure out who in that office you should talk to. I always like to flag what an office structure is like. This is a really, really bare bones. The Senate's a lot bigger. The House is a lot smaller. But the people that you want to talk to when you go to the Hill are going to be your legislative assistants. They're your policy experts. They're the people who are drafting legislation. They're giving vote recommendations to their boss. They're making talking points and talking lines for committee hearings. They are a powerhouse of staff who you really want to connect with and maintain long-term relationships with. As a heads up, though, in the Senate, they might have 1 to 2 issue areas. But like me as a former House staffer, I had 6+ issue areas. And so it's important to remember that when you go into a room, having these conversations with these staff, sometimes they're handling about a dozen things just for that one day. They might have 7 or 8 different issue areas that are all in the news and really taking over their time. So be considerate when you're talking to them and use the opportunity to be a resource and educate them on your issues. Gary will absolutely be talking a little bit more about that when you're actually talking to staff. Next slide. This is a breakdown of the committee structure, slightly different, but very similarly, you'll want to end up with your professional staff members. They're those policy experts. They're the ones who really will know your issue well and want to be interested in talking with you about your topics. Next slide. So you've got the offices that you're going to meet with, member of the Congress. You've now figured out the staff that you want to go talk to. Now let's figure out how to structure your meetings. Versus a Hill day, which sounds like folks are doing tomorrow, versus say uncoordinated or individual meetings. Both are really good for different reasons. Hill days are really great if you want to make a splash and really highlight how much support there is for your interests or how many people care about it and want to participate in it. And you can sometimes even get a little bit of a media attention around it to showcase that in the DC orbit. Challenges, sometimes it's hard to actually manage all that. If you've got people flying in, you're trying to hit 10, 20, 40, 50 offices, a lot of scheduling that you've got to figure out. That's a challenge. Those are the pros and cons of it. An uncoordinated meeting, a little bit easier, not as flashy or show as having the people around, but they're still effective in having meaningful conversations with staff and establishing those relationships going forward. Very similar to that is if you want to do an in-person or virtual meeting. One of the very, 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 very few things that came out of the COVID pandemic was the ability to do virtual meetings, which staff sometimes prefer. It's a lot easier to schedule those things. They can do it when they're both in session, which is all those yellow and blue and colorful days, versus out of session, which is when their members are not in DC and voting in the district. Sometimes the schedules are a little bit lighter and easier to tuck people in. When I was a Hill staffer, I took meetings, virtual meetings, and I'd have a dozen people calling me from New Jersey. It was great because they didn't have to try to coordinate flying or hotel rooms or getting one in. It was just a 30-minute block on everybody's calendar. And it was a great way for me to see that there was a huge presence in New Jersey really, really focused on this issue. So it's easy to sometimes, you can do either one. It's great. Both of them work in nowadays. So as I kind of just want to flag, it's figure out your goals, figure out what you want to do, figure out if you want to be making a big splash, if you want to build relationships, if you have any structure, you need to figure out other people's time and coordination and figure out what makes sense for your group. So this is a really big one, and it's very important in the DC world. There's a lot of things moving right now. I'm sure all of you have checked the news at some point today and everyone saw something different. We probably all wanted to read a different bite-sized piece of news, but people on the Hill, and as I referenced, like a House staffer is handling 6, 7 issue areas, Senate staffer is handling 1, 3 issues. There's a lot of things moving and absorbing the political oxygen in DC. So making sure that when you go to the Hill and you're thoughtful about the staffers' both mental space to listen to you and the time so that they can sit down, a thoughtful conversation with you is really, really important. It would be very unfortunate if, say, right on March 14th, the federal government shuts down. Staff are going to be running around like chickens without their heads. And if you're coming in and you're saying, I would like to educate you on this thing that you cannot act on in this moment or is not relevant to this time, they're going to be like, great, thank you, bye. And then unfortunately, you're going to have to do a lot of follow-up. You're going to have to like probably go back and have that education meeting again. And so thinking about where your meetings are landing in the cycle of the hill is really helpful to make sure that what you say lasts. So I put up this graphic here just to give you an idea of all the overlapping things that are happening in Congress right now. So, right, we've got last year's appropriation cycle running out. We've got what should be FY26 should have started the first week of February. So that's always delayed. You've got them working through the budget reconciliation process. That's how they have the Inflation Reduction Act. You've got efforts to repeal all sorts of rules from the last administration. Congress is hectic, to say the least. So thinking about how your interest and what you want to talk about can either is relevant to what's moving, or if you can make it somehow relevant to what's moving, will help staff really lock that into their brain and go, okay, that's something that that is important to me right now, or that is something I could use right now, or that is something for me to keep in mind when this comes in front of my boss in their committee, or from my boss at their caucus that they're talking about. So just the rhythm of DC moves fast, and I always like to encourage people to think about that. Bye. Oh yeah, so this is just a little bit more about all the things that are moving this Congress and the various priorities of each of the parties, both in the House and the Senate. So it's going to be a busy Congress for sure. And so seeing if there's ways, as you look ahead on the major themes, is there something in there that you're like, ooh, all right, that's moving. I should jump on that, make sure that my issue that I get there and can educate the staff about this, because this is going to be relevant to them. And you want to be a resource. You want to help educate them going forward. So that's just a couple of things moving here.
Oh, sorry, can I ask you a question?
Go for it.
NDAA?
National Defense Authorization Act.
Oh, okay.
It is all the authorizing policies for defense.
And it is a must-pass bill.
Yes. Every year. So unlike, for example, say the Farm Bill, which is a 5-year authorization, NDAA, much like the annual appropriations process, it's a 1-year process. Or it must pass every year. Great. So then finally, the why. So why are you doing this? Congress is really great for 2 reasons: Congress for communications and Congress for policy. Members of Congress have a platform that reaches a national audience, in addition to, of course, their constituents, their districts, their states. And so using the opportunity to go in and educate them on your issue so that they can become an ally and a champion of your issue is very, very important and really valuable. Like I said, they have a lot of opportunities to have that spotlight, whether it's committee hearings where they have to do opening remarks and a question line, or if it's a press call that they want to have or that they've been invited to, or any sort of legislation or interviews that they're doing. Making sure having an educated member on your issue is really helpful to then continue to spotlight and highlight things that you are prioritizing and that is important to your organization. The other side is then Congress for policy. Well, more probably what you expected. They pass bills, they do the annual appropriations process, fun thing, ideally. And so they also become, if you have a champion, they can either help, advance your issue through legislation or prevent, bad things from happening. So seeing Congress as both a tool for communications and for policy is really helpful. So before I go on to my bonus of climate in this 119th, I want to quickly pause there. I blew through a bunch on the who, what, where, when, and why as fast as I could to leave time, but are there any questions? Go for it.
So I live in a pretty ideologically, extreme location.
Mm-hmm.
And I guess I'm just wondering, because I don't necessarily participate in that, apart from like the performative value of this exercise, what can I really expect to achieve? Knowing that we're not finding a lot of common ground. Yes.
Can I take a shot at that?
Go for it.
And I'm sort of undermining my own slides, but that's a great question. So climate change is really big. And you may think, I'm going to go into the conservative member's office and talk climate change, and that member is not going to hear me, and that staffers. Climate change is not a monolithic issue. Climate change is tax credits for electric vehicles. It's sustainable agriculture. It's wildland fire smoke. Part of the art of being a successful advocate and successful lobbyist is finding something a member can say yes to. I have worked with people at every end of the spectrum. Sometimes someone is my vehement opponent on tobacco control, but they might be my supporter on NIH funding. I think the climate space is varied enough that if it's not agriculture, maybe it's wildland fire. It's certainly wildland fire smoke. So if you're in Montana or Idaho, some of the conservative middle of the U.S., wildland fire smoke is a constituent issue. Whether you want to connect it to climate change or not is a separate issue. But the interventions that address climate or the wildland fire smoke are still climate policy. So I guarantee you, if you dig deep enough and hard enough, you can find something they can say yes to, even if it's not the big slice of the pie that we all want.
And on that, there are a lot of things that must happen. As we said, that National Defense Authorization Act, Farm Bill, annual appropriation, these are all things that must pass, they need to move through Congress. So also thinking about what legislative vehicles exist like that to try and attach your priorities is a good way to think, well, maybe that standalone bill is not going to do it. That might be a messaging strategy when you get that one member of Congress who's super excited about it and they've got one bill. One bill moving through Congress is hard. It takes several Congresses to move a lot like that. But is there a way that you can shape your priorities to match the legislative vehicles that are moving so you can still find progress through policy in addition to shining a spotlight on something or elevating, highlighting your issue through the comms apparatus.
As far as even like asking for an amendment or something that seems to
Yeah, so for example, right, they just did the Senate is moving through their budget reconciliation, both chambers are moving their budget reconciliation process. About 2 weeks ago, they had the Senate Votorama, which was up until about 5:45, 6 a.m. overnight voting on amendments. That's sure. Amending a vehicle like that works, but in the appropriations process, in addition to funding levels, they have report language, which is essentially the instructions that accompany the funding. So let's say I give HUD $100 million for public housing, the public housing, the capital fund, which is how they do repairs. I could say historically that funding could only be used for maybe it's fire sprinklers, mold, insulation repairs, but maybe I also add in the next year saying gas smoke detectors, not just sprinklers, but detectors as well, right? And you say more things can have access to that funding. So it's instructions that accompany the funding, or say it's directing the agency to use some of the funding to study the impact of wildfire smoke on children. Like you can incorporate things into the report language text that accompany and direct how they are funding. Okay.
I had a similar question to her because tomorrow I'm meeting with my senators and representatives, well, their staff from Tennessee. And so just leading up to this conference, I was like, what is the point? Because our ask is, will you continue to support IRA and IIJA funding?
Yeah.
And I know that Marsha Blackburn, if Trump says jump, she says how high, right? This is recorded, whoopsie daisy. So I asked Senator Bill Frist this morning for advice on this topic, and he was like, oh, absolutely, like, don't talk to them about the IRA because that's already decided. But he said for Tennessee specifically, talk about environmental protections, and he's with the Nature Conservancy, so he was like specifically talk about nature-based solutions, stuff like that. So I'm gonna do that, but I'm having trouble then matching it to the right ask that is relevant to whatever's going on with like bills and stuff like that. So
think about that. In terms of organized Hill days, I understand Senator Frisk's point of view. But we ask everyone to make the same ask on the same day.
Good.
Just because it becomes chaotic because you're going on behalf of organizations. We just want to make sure that there's like a united discourse. Now, if you're going on your own, absolutely. But an organized Hill day is a little bit different.
Okay, got it. I'm glad I mentioned that.
Yeah.
And if I could add to that, Thank you, because talking to a senator from California gets us nowhere. We have to have people talking to senators from Texas, Tennessee, Kentucky, and Mississippi, because we don't change the discussion if we're talking to people who already support us.
Yeah. But
I'm wondering if, now that you've said it, if I should sleep in tomorrow. Yeah, I'm from Maryland, blue state. I'm in a very blue district. Jamie Raskin is my rep. We have, I know our senator who is returning, is a very strong climate advocate. I think our new senator probably is, although she hasn't had much time to show it. We have some new representatives who I think will probably be good on climate, even though we haven't talked to them about it yet because they just were elected. And then we have Andy Harris from the Freedom Caucus, who probably won't even talk to us. So is there a point to be going to the Hill tomorrow?
yes, yeah, absolutely. And the same, there's there's value to going and showing the friendly representatives to your interests that there's people supporting them and backing them. Because you never know when a hard vote, for example, comes up that's really a challenge for them. So it's still valuable to go and say, hey, there are people who are here, who are loud, who support this issue. You're not alone, to give you cover, that are present. It's still very valuable to have those conversations, as well as building those relationships. You might be meeting with a new staffer. There's a lot of turnover on the Hill. And so you might be meeting with someone new who right now, they're like, sure, great, this is an easy thing. But in like a month, in 2 days, there's going to be a new issue where they're going, who do I know who was in that space, and I could use some help thinking about or understanding this issue. And so you want to be a resource going forward. Yeah.
And I will add, members of Congress who you agree with, we tend to take for granted. They need to be praised publicly and lavishly. If you have a local newsletter that you contribute to and you visited the Maryland delegation, you should thank those supporters in a very public way, and not just thank them, then you send that copy to the office so they know that if they speak to you, they're speaking to a larger audience. Again, I'll talk about that a little bit more.
Yeah. So I'll flow through this and we'll get to your question. Oh, go ahead.
Yes. I'm a former state senator, and so everything you're saying, I was interested in the difference between Congress. But one thing that Chris said this morning that no one has mentioned that I think is really unique about tomorrow's experience is that everybody's going up there is either a doctor, a nurse, or a healthcare provider. So when you go to Tennessee, and I know this from the other side of the aisle up in New Hampshire, you start with saying, I'm a doc or I'm a nurse. And remember what he said? He pointed to us and he said,
He's read my slide.
health. But health is, he talked about health, and you lead with health, whether you're going to talk about the Inflation Reduction Act or whatever. You lead with health, you lead with your credential, and that's why they'll listen to you. And it made a huge difference up in New Hampshire when we were up. You know. And in Virginia, we had white coat days, and we'd all show up in our white coats when I used to practice in Virginia. And it made a huge difference. Didn't matter if they were red or blue. And there's a little bit of an ego on a lot of these guys, so I agree 100%.
I know it was mentioned about coming in white coats tomorrow. Is that recommended?
Yeah, we ask folks to come with their white coats because it creates visibility and buzz to the point that Carianne was making. You know, part of this is folks that show up in these large constituencies. One year we were there with the Alzheimer's Association and they were all wearing purple. And so it just, wherever you went, you saw purple. And so it kind of creates this like groupthink, and they, you know, a staffer might have had a conversation with you, sort of forgotten about it, see the purple, remember that conversation. It just creates a good visual image.
It is amazing how much of politics is theater. It's part of your costume.
Yeah. It's something, and I, at the end of the day, I'm a lobbyist. So like something I always tell my clients is that I will never be the best storyteller. I'm a lobbyist. I'm not best messenger. The people who are better messengers are folks like doctors and nurses and yourselves who have those credentials and have meaningful experiences to tell. So leading with that is really, really, really powerful, and a good thing to do. I'm going to fly through this so that Gary can talk about his slides, which also talk cover a lot of the questions that we've had so far, but I wanted to cover a little bit about the climate conversation, knowing that this is not relevant for tomorrow, but in this Congress, something that we've noticed is a lot of the impacts on individuals and costs and the cost of the federal government. So something to think about as you're going forward in your conversations, if you're having conversations around climate, is what are the financial impacts of, say, for example, the funding freeze to IRA and IIJ. There's a report that came out from Climate Power today that said there's tens of thousands of clean energy jobs that have been lost since the executive orders that froze the funding for IRA and IIJ. So just wanted to emphasize that there has been a heavy focus on what's the energy burden to homes. That's how we've ended up with a lot of that all the above energy approach right now. So that's that they've expanded. The Republicans in this Congress are not so much bashing clean energy everywhere. There are some folks who still obviously want to repeal and block IRA and IIJ funding, especially to offset their budget reconciliation plans, but there's also plenty of folks who are fighting for it right now. And so last year we had 18 Republicans, 14 are returning, who really have pressured Johnson not to so aggressively and in a sweeping manner take out IRA funding, the IRA tax credits. But I think bringing things to that individual cost element, we've seen some more conversations, for example, like home insurance. It's something so personal and so individual that people are thinking about. What's your utility cost? I think when it comes to the health space, what's the impact to the healthcare systems, the impact to the individual and the affording their healthcare. And so thinking about those individual impacts as it relates to climate change can help, I think, the conversation going forward in your space. But turn it over to you.
Thank you. Before I start my slides, who are you? How many people are physicians? How many people are nurses? Okay.
Wait a second, you didn't cover everybody.
I'm sorry, who did I miss?
I'm a public health professional.
You are welcome in a valued member of this discussion. Thank you.
Am I the only one?
No, I'm a psychologist.
Okay. I'm curious, any pulmonary critical care sleep docs? All right. So how many of you have done Capitol Hill visits before? Okay, so you've done this, you've had some experience, and you're hoping to sort of make it a better, more refined experience. Okay, so my name is Gary Ewart. I'm staff at the American Thoracic Society. I've had the pleasure of working for the ATS for 30 years now. Prior to that, I worked on Capitol Hill for Senator Regal of Michigan. This was during the end of the first Bush administration, beginning of the Clinton administration. And I would have worked longer, except Newt Gingrich came into town in 1994. There weren't that many jobs for bright Democratic young staffers at the time. So I've had the fortune of working with ATS. So Lisa, thank you for organizing a really cool meeting with a lot of great speakers, inspirational speakers. I am not one of them, but I do have 30 years of experience both listening to Hill visits and participating in Hill visits, and might have some insight for you. Next slide. And I owe you an apology because I did this with a lot of animations. So you're going to hear next a lot. So I am a full-time employee of the American Thoracic Society. I do own some fossil fuel stock. I have about $40,000 of car company stock, a lot of Tesla, which a couple of years ago was sort of a really cool thing. I felt like I was investing in the future. I feel much differently now. Talking to my wife about being agree with that. I do not have other conflicts of interest. Next, please. So the American Thoracic Society is a medical professional organization, pulmonary critical care docs. Like all other medical professional organizations, we publish journals, we have an annual conference, we put out clinical practice guidelines. I don't do any of that. I'm an advocate. I'm a lobbyist. Next, please. So what I'm going to cover is whose opinion matters, how to make your case, who you are meeting with, what to do after your meeting, and if we have time, maybe some thoughts about how to take advocacy beyond Capitol Hill. Next, please. So, back. So, who do you think the most trusted profession in the U.S. is? All right. So, as you know, as I'm sure many of you are aware, Gallup does an annual poll where they poll the American public on what are the most trusted professions in the United States. And for years, nurses have scored consistently the highest of the trusted professions in the United States. Next.
Would you like to?
Sure, that might be. So, physicians, 56% report high or very high. Clergy, 32, lawyers, 16, car salesmen, 8, senators, 8, congressmen, 6.
Can I add one more line in here? Because I heard there was a pharmacist. I think pharmacists and doctors are tied. It's also quite high.
Yeah. So, overall, as over time, over these Gallup polls, the trust in all professions is declining. So we're seeing some institutional devaluation, but you, nurses, physicians, are still a highly trusted voice. Just so you know, I didn't make it up. That's the entire list from the, I believe, the 2023 survey, which is reported. So you are a trusted source of information. You are more trusted than the person you're talking to, the person you want to talk to. You're valued in your community. And your opinion does matter with policymakers. And I will say it matters more than your typical constituent because you have a shared interest in that your job is to take care of patients as a healer, as a caretaker. Their job as politicians is to take care of their constituents. And I'm going to go a little off script here. One of the things that was I enjoyed about this meeting was the constant refrain to tell a story. And I'm not sure how many of you were at the workshop about how to refine your story. And a lot of people said, I'm doing climate change because I care about my kids, which personally is a very compelling story. And I want to address climate change because of my kids. But I will say that is, in my opinion, and this is opinion only, that is not a good story to lead with or a rationale to lead with up on Capitol. Because I will tell you, there are people up on Capitol Hill who say, I want to have access to guns so I can protect my kids. I want to close down the border so I can protect my kids. I want to not have vaccine mandates so I can protect my kids. Protecting your kids is really not what opens the door, in my opinion. What does open the door is that you are caretakers, you are healers, and you are seeing the health impacts of climate, not tomorrow, but today. So when you have your meeting, establish who you are. I am a healthcare professional in your state and district. I provide healthcare for your constituents. I work at an academic center or a hospital or some other likely major employer in the state. So not only are you a healer in the state, you are part of an entity that is important to constituents for both health reasons and economic reasons.
Can you say that whether your institution supports you in being here or not?
So you can say, where are you from?
New Mexico.
Okay, what institution you are at?
I'm the executive director of the state affiliate Healthy Climate New Mexico, but I work with physicians and other people who, some of them work for the government, some of them work for our major hospitals, some work for an FQHC, and they're here on their own time.
Right. So let's say I'm a healthcare professional from the University of Tallahassee.
University of New Mexico Health Sciences Center.
Yeah. And Tallahassee doesn't want me to speak on their behalf.
Yeah.
They can't tell me that I can't tell them where I work because that's where I work. So you would say, I'm a physician at the University of Tallahassee. I'm here speaking as an individual on behalf of the Medical Society on Climate and Climate Health.
Thank you.
I'm retired. I do some volunteer work as a physician. And how should I talk about that?
I used to work.
You are an MD. Mm-hmm. You're still a doctor. Yeah. And you can still speak with the expertise, training, and status that you have as a healthcare provider, and should.
I'm also a Navy captain, so I should just tell them I'm a retired Navy captain and physician, and they can figure out what parts go together.
As part of your story.
Yeah.
Okay. So, you'll probably hear this a lot. Congress does not legislate by anecdote. Bullshit. They use anecdotes all the time, and part of our challenge is to take the data, the facts, the figures, the science that we know is real and true and describes our world and how it's changing, and put it into distilled story that makes that data come alive. So don't just talk about the LA wildfires, show pictures. Don't talk about the displacement of Hurricane Katrina or other hurricanes. Tell a story about it. So you have to cite the evidence that says that wildfire smoke is bad for health, but tell a story about that kid or that adult who's in respiratory distress because of exposure to wildfires. Don't say, I have patients. Tell about Bob or Jim, whoever that patient is, to the extent of HIP and all that sort of stuff. Make it personal, make it real, don't make it general. Who's your audience? You're going to meet a lot of 20-somethings who recent college graduates who are smart, eager, but not too far out of college, so they're a little shorter on life experience than many of us in the room. Some of them will be decision makers in the not so distant future. Many of them will stay on the Hill for a while and will become the committee staffers on Ways and Means and Energy and Commerce and Senate Finance Committee that really hold the keys to policy making. Some of them will go on to work for the American Thoracic Society or off on Capitol as lobbyists for good guys and bad guys. So don't undervalue the role they play in the process. Try to become a trusted source for these staffers. And the most, or I think one of the most underappreciated things is to save time to ask them, what's on your desk? I've had some of my most productive meetings, not when I told them what I wanted them to hear, but when I took the time, hey, what's on your desk that I might be able to help with? Oh, you're interested in cost for asthma medications? I have some people I can connect you with. Oh, there's a problem. You see a spike of e-cigarette use in your community? I can put you in touch with a pulmonologist who has some thoughts on this. Leave time at the end of the meeting to really understand what's on their mind at that moment and if possible connect. And then become a key information source. So what do you do afterwards? Well, the important thing to know is this visit is not the end of the advocacy process. It is the beginning of the advocacy process. You do the obvious, you send the email summarizing your points. Thank you very much for your time. Here's why I came to talk to you, and here's to remind you of the key points that you take home. And you keep reminding them, monthly. Send them an article that says climate change bad, addressing climate change good. Whether it's the health of their constituents or new studies showing the economic adverse health effects or the economic impacts of climate change, just keep pinging them. So one, they know you're not going away, and two, they see you as a source of information. And then we get to thank and spank. This is a phrase a lobbyist friend of mine, I'm not sure he coined it, but he certainly made it famous in our offices. Public praise is what politicians thrive on. So as I mentioned earlier, and they don't like public criticism. So if they do something good, and this is something I, as an advocate, have done a poor job of, is really creating opportunities to lavishly, publicly praise people when they do what you want them to do. So how many of you are part of a professional society that has a newsletter? Then you have space to reach out to the staffer at the American Society of Gastroenterology or whatever your specialty is and say, hey, we did this visit. We got what we wanted. Could you put this in your newsletter? Can you put this on the website? There are state societies that you can work with. So some sort of public platform that shows that not only are you an individual advocate, but you have an organization that can amplify the good work the member of Congress is doing or the bad work. Letters to the editor can take care of that. Association newsletters, social media posts. I'm kind of old, so I have a Facebook account that I haven't visited in 10 years. So I don't really understand. I believe in the power of social media, but I don't really participate in it. You're probably in a much different space than I am. But social media has power. For those who fully can take advantage of it, you should. And then teach me. And make sure the office gets a copy. And then the reverse. They don't do what you ask them, you hold them accountable. So let me pause for discussion there. There's a lot of questions, and let's make it real. Either we've done a really good job or a really bad job.
We got one in.
Yes, we have a few online questions. Somebody says, fantastic practical advice, but this seems daunting to clinicians. Do we need to hire an expert to help smooth interactions and provide advice? How do we find one?
You got something like what you're doing tomorrow, so that there's organizations that exist.
So let me say, if you've done practicing clinician at any point in your life, you've probably met with patients and you know how to ask questions, engage in dialogue. If you are part of an institution, have had to ask for more space for your lab or a parking space, you have the basic tools of going to meet with a staffer and saying, here's my case, here's my ask. I don't think professionals are useful or as useful in that immediate interaction. As you say, we're not the storytellers. You guys are the storytellers. The value that we add is, here's where you need to get your story. Here's the timing of the story. Here's the right person to hear the story. And then all the sort of intermediate or in-between follow-up as the legislative or regulatory process or sometimes court process goes forward. So you guys have the skills, you guys have the credibility, and you have the stories in working with your patients and your communities that I think really make the issue live.
Add one thing to that. I know it feels daunting, and I'll say if you're new to this, it's really a good idea to go on an organized Hill Day. And you can do that through, we obviously offer it. Lots of other climate organizations offer it as well. Professional societies do. So my very first Hill Day was through the American Academy of Pediatrics. And the benefit of that is that you get to, you're handed your talking points, you're in a team of people, you're really well supported. And then once you do enough of them, you get the rhythm for it and then can figure out how to go out and do it on your own. So it can feel daunting the first time, but there are plenty of groups that do it, and join one of those groups and do it that way first.
Carianne, I have a question for you. So you're absolutely right. There's been a significant pivot from in-person meetings to virtual meetings, which opens up all sorts of possibilities. You don't have to spend the time of flying to DC. But I can't tell you how many virtual meetings I've been in where either the Hill staffer doesn't have their camera on, or if they have their camera on, such a glazed look. And I wrestle with, how do you make the virtual meetings as impactful as the in-person meetings? And I'll add a little information on that is, I have had long discussions with my lobbyist friends on whether doing a PowerPoint slide is a plus to keep the people engaged, or whether that just makes them turn off easier. I welcome your input.
Yeah, well, I think it's actually a point that you made in your slides, which is a really good thing to do in your meetings, is to engage the staff, ask them a question. What are they hearing? What are they keeping an eye out for? What's on their desk? As a way to keep the staff engaged in the conversation, so they're not just receiving what you're saying and great, thank you, have a great one, and closing up shop. So finding a way to have a question and talk to them about that. Are you familiar with this issue? Or thank you for your boss for doing this. Are you going to move on that piece of legislation that they've introduced? Or have you seen this one? Like, have you heard of anything happening in this place? Use them as a resource as much as you are a resource to them. And that'll help, I think, keep the conversation more and more energetic and engaged, so you don't get that, great, okay, thank you, bye, sort of response.
Thank you for your views. I'll pass them on to the senator.
Oh yeah, I'll run them up the chain. Like, yep, thank you. Those, definitely hard ones. I think that will help. There is definitely, I think some people will have their camera on, some will have their camera off, but finding a way to connect with that staffer and then do that follow-up meeting. Maybe this time around that camera's off and maybe they're like, great, thank you, but you have a follow-up, you shoot them an email, you follow up with them the next time. They're like, hey, great to hear you back. Here's an update on that thing that you asked about. What else is happening? Or like, you start to build that relationship. It starts small. It always starts small, but it can grow in a very, very meaningful way. And so looking at it as just as a place to start and build from there. There are plenty of times when I was a Hill staffer, and that first one, I was like, okay, thank you. Like, this is a new topic. Like, I need to go do research on it. But building that relationship then, and the next meeting around, I was like, I know exactly what you're talking about. I've got a follow-up response to that. It's way more engaging. And so, yeah, just building that relationship as you go, I think is really important, and not just throwing all your stuff at them, bouncing. Same thing for you.
I have a follow-up to your question. So I had from earlier.
Yeah.
Why do we talk to people who don't agree with us? I'm going to tell the story of Daniel Donay, who was a staff and House member from Florida, who was elected in 1994, which is the wave of the Republicans taking over the House and the Senate. And we wanted to talk to her about NIH. She said, my boss is elected to cover. That's all I'm here to do. That's all he's here to do. Left that meeting somewhat discouraged. Well, I was one of a whole bunch of lobbyists going in to talk about NIH. By the time 6-8 months later, when I went back to visit her, she said, you know, I've heard from a lot of people about the value of NIH. I think we can get our boss on this. That's a win. So the next thing was, well, we also think CDC is fine. Well, my boss is here to cut the budget. We need to cut to all this. And me and my colleagues and lots of other people kept making visits, educating her office and her boss's office about the value of CDC funding. And about 6 to 8 months later, it's like, you know, NIH is really good, and I'm starting to see the value of CDC. That is just one example of repetition and persistence can slowly change minds. It didn't happen in one meeting. It didn't happen in one email. It didn't happen because of my influence. It happened because of the advocacy of myself and my organization and dozens of other organizations sending a consistent message about NIH funding and CDC funding. Those same tactics can and do work, not as quickly as we like, but they can work in the climate change space as well.
And especially as it relates to climate change, things are changing fast, right? We had Hurricane Helene and Milton come through places that were previously considered, you know, climate havens. And now that's a very fresh issue for the members who represented those districts and that state and the local communities. And so not saying to take advantage of catastrophes and crazies, but things are changing and you've got members who are getting businesses, manufacturing, more jobs are created in their district. The EV companies who previously would be like have voted against climate-related funding, but now they're fighting for it tooth and nail, right? So things are changing and being present in those repeated interactions, at some point that door might open quite willingly and being prepared to walk through it. I think you had your hand up. Oh, I think you had your hand, yeah.
Just going to make one other point about that question that came in, and that's doctors and providers and nurses are used to two things. And again, it's what makes this group really unique. One is they're used to taking really complicated information and distilling it down. And the one thing I've noticed about a lot of legislatures is they don't know what you're talking about. And you're educating them as well as trying to get them to see the big picture. And we're really good at educating patients. And so a really reassuring thing for me, a big aha moment for me was talk to the legislators like you talk to your patients, explain and educate in the same kind of terminology that we talk to our patients and use the stories. And it's hugely powerful and they will really appreciate it. Especially those legislative assistants straight out of high school or college.
Yeah. A two-part question. One is, what is the Conservative Climate Caucus really about? Because my member Van Brew that I'm going to be meeting with is part of that. And secondly, I know that he despises offshore wind, and I almost as much despises electric vehicles, but he does support solar. So does it make sense to mention the IRA in conjunction with solar, or just keep the general IRA focus?
I think it's always better to find the way into that member so that they have a reason to be interested in it. However, I think it's simultaneously dangerous to sometimes protect when there's 10 things on the line and you're like, okay, well, I'm just going to protect this one. And as soon as that one is protected, then you just forget the remaining 9 and everyone else has got to go fight for themselves. So there is a value, I think, to sometimes defending the whole thing altogether and saying all of this is very, 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 very important. And we need to stick together to keep fighting for those things. But your question on the Conservative Climate Caucus, much like some of the other affinity groups, sometimes it's just nice to have that title on your website that says we are part of an organization. I think that the caucus, there's a long way for it to go to do a lot, to do enough when it comes to addressing climate change. But there are some folks who led that caucus, like now Senator John Curtis, who's now over in the Senate, who have done a lot. Mariette Miller Meeks, who's currently the chair of it, she's was part of those 18 members who signed on to the letter to say, don't rip apart the IRA. So there is definitely some interest there. But, they did just pass their budget reconciliation process and a budget resolution to kick off the reconciliation process, and only one House member voted against it, not for the reasons that Democrats voted against it, but that will absolutely put a lot of that on the chopping block. So it's absolutely worth going in and having that conversation and talking about it with that member.
So Lisa, I have a question for you. Let me preface it. When I go to the Hill, or the ATS members that I'm working with go to the Hill, we usually have specific asks of vote for this bill or sign this dear colleague letter. And part of the art of what Carianne and I do is to figure out what is the right specific ask to ask of a member of Congress. Part of it is to figure out, you ask them to do what they can do, not what they can't do. You guys are, tomorrow, this is not an ask Hill Day. This is an education Hill Day.
We educate our lawmakers. We do typically have an ask associated with it, but it cannot be for a specific piece of legislation or a specific resolution. But last year, for example, we asked for their support for the suite of EPA regulations, anticipating that a lot of them would undergo CRA. We were trying to bulk up their support. And so we do go with an ask, but it can't be tied to a specific piece of active legislation being considered. We can't lobby.
So that's important for you to know tomorrow, in that you can talk about the good things that are a result of the IRA and the good programs that you want to continue. But if there were, say, legislation to repeal it, you couldn't say vote against that, because you are serving in an education capacity, unlike my members when we go to the Hill are speaking in a advocacy capacity.
And you don't need to worry. We put this together with the ALA, whose funding is only allowed to be used for education. So as long as you stick to the script, you will be fine.
We're just about the hour, but I see a couple of questions.
Do we want is there another one online?
Yes, we do.
Give the online people some time.
Yeah. So actually, you kind of answered one of the questions that someone asked, like, how do you toe the line between advocacy and lobbying? So there is another question that asks, how do you recommend following up with policymakers if the policy change does not produce the desired result?
I would say, to an extent, answer that a little bit, bank and spank. If they do what you want, or even do something of the menu of things you want, you thank them for. If they don't, then you hold them responsible. And you, in your newsletters, express your disappointment about the recalcitrance of that member of Congress, or you plead with them again on why are you ignoring your constituents? Why are you ignoring the health of the people who live and die in your district? Try to keep holding them accountable. It's not a perfectly satisfying answer, and it's not guaranteed to succeed. But if you make that case publicly, you can get change.
Can I ask a question kind of adjacent to that? One piece of advice I had heard is that the staffers are typically like looking at the local news where they are, the local newspapers, just to see what their constituents are thinking and feeling. And so it's a great place ahead of going to them to try to get something placed to say, hey, look, this got placed. It's an important issue to your constituents. And I just wanted to, if I could get y'all's comment on that kind of as a strategy, either before or in the thank and spank realm after.
Both, absolutely both. I think going before and gathering the stories locally is really valuable. And then after the fact, too, especially if you're trying to hold them accountable. Say they voted on something not the way that you wanted them to. It could come up again in another way or another factor, another vehicle, same issue, and hope to change them, right? So they now need cover to change their vote, right? They now need to see, a huge influx of calls came into their office that say, like, vote this way. They need to be able to, when they publicly go, I voted a different way on this because, and it's like, because their constituents were calling, because they've heard from their communities that this is really, really important for them. So there's, hopefully there's another point where you can address the issue again, and if that's the case and they voted the wrong way or they've done something like that, you need to give them cover, is what we always say, so they can make that flip down the road.
To build on that point, my most active members come from the academic world. So when they think of publishing, they want to be in the New England Journal of Medicine or Science, the one with the biggest impact. So when I talk to them about letters to the editor, yeah, I'd love to be published in the New York Times and the Washington Post. So would I. But if you really want to get your message, those small community newspapers have greater impact than I think people realize. They're also hungry for content. So if you, a local physician or a local nurse or a local public health official, write a letter to your local newspaper, your community newspaper, not only is it far more likely to get published, it's far more likely to get the attention of a Hill staffer. Just out of respect for people's time, we're at 5 o'clock. I'm happy to answer any more questions, but I don't want to keep people any longer. But thank you, everyone, for your time. Carianne,